After an extraction of a non-restorable tooth, a question comes up regarding whether or not we should socket graft the site. So this is a question that we often encounter both clinically and from the patient's perspective. So essentially, we'll determine, it's based on whether or not the buccal plate of walls surrounding the socket is intact or not. So after the removal of the non-restorable root, it is critical to evaluate the surrounding walls of the socket. If any of the walls, usually the buccal plate, being compromised with the dehiscence or fenestration, it is often recommended that we preserve that socket with some grafting material. So after the extraction, we'll evaluate the socket walls. If everything's intact, the recommendation is just let nature heal by itself with a clot formation, and about 4 to 6 months later, the bone regenerate on its own. However, if again the buccal plate is being compromised, then it is often recommended that we slow down or retard the bone resorption, the residual ridge resorption pattern, by having a graft material. What types of material? We have 4 choices: the patient's own bone, autogenous bone. We have xenograft, which is an animal product. We have an allograft, which is a human donation product, or synthetic material, an alloplast. So usually the recommendation is about a 50-50 mixture of human donated bone or cow products. So in this regard, that we will preserve and regenerate that site. So for future potential implant placement or for potential pontic site development, this will slow down the residual ridge resorption pattern. The only one exception to this scenario is in the premaxillary area. Usually the buccal plate is very thin and compromised, and even if it's intact, there is the literature that supports that the buccal ridge will resorb up to 75% its volume within the first 3 years. So in the premaxillary area, due to aesthetic and due to other indications, it is probably prudent to preserve that socket for future regeneration so that we can consider a pontic site development or implant placement in these anterior zones of the mouth.